202 Pathology. We're going to go over the Introduction to Pathology as our first module today. Be sure to also follow along in your textbook in Chapter 1. The objectives that go along with this module are we're going to define basic terms related to pathology. We're going to discuss the difference between structural and functional diseases and the causes of diseases. So what is pathology? Pathology is simply the study of disease processes. Then we ask, what is disease? Disease is any type of abnormal change that occurs in the body with its function or structure. Pathology follows the sequence of events that lead from the cause to a disease to any abnormalities that occur and how the disease is displayed or what is known as manifested. This sequence is also known as pathogenesis. When the cause of the disease is studied, it is known as the etiology. So once the pathogenesis sequence finds what the actual disease is, a diagnosis occurs, and the patient's condition is assessed. Then the physician makes a prediction of what course the disease will take and possibilities of the patient's recovery. So diagnosis is the determination of the actual disease, and the prognosis is the prediction of what is made. Without the diagnosis, the prognosis cannot be determined effectively. So physicians tend to look at the clinical manifestations that occur with an individual when trying to come up with the correct diagnosis. We know these as signs and symptoms. Signs and symptoms are very similar to objective and subjective data that we discussed in patient care in semester 1. Signs are the objective data that are physically observed by a healthcare professional, such as a rash or if a patient has an abnormal pulse rate. Symptoms are then the subjective data, the patient's perceptive. These are things only the patient can identify, and these are things such as a headache or abdominal pain. These signs and symptoms are not helpful with finding a diagnosis. This is when testing starts to occur to assist in the diagnosis. Now, we said a disease is any type of abnormal change that occurs in the body with its structure and function. So when a disease is classified, they are classified by either structural or functional. When a disease is classified structurally, the cell changes physically and biochemically, which is also known as a lesion. For a disease to be considered structural in nature, the organ must be altered in some way. And there are 3 categories that fall under structural, and they are genetic and developmental, acquired injuries and inflammatory, and hyperplasia and neoplasia. We're going to discuss the first subclassification first, which is genetic and developmental. And is any disease that is caused by an abnormality in the genetic makeup or changes that occur in utero. Now, these abnormalities can be present at birth, which is also known as congenital, or can develop later in life, and that's usually hereditary diseases. And they're given to you by either a parent or another ancestor, such as a grandparent. Now, the next subcategory, which is known as acquired injuries and inflammatory diseases. These diseases are caused by some sort of external or internal agent that destroys cells or cause the human body to injure itself because of inflammation. We'll go into more detail into the next module with this though. So the last subcategory is hyperplasia and neoplasia, and these are diseases that have an increased cell population, and the hyperplasia occurs due to an external stimulus that is there for a long period of time, and we usually regress when the stimulus is removed. Neoplasia occurs from a genetic change, and that produces a single population of new cells, which we'll also go over these in more detail in the next module also. So an example of a structural disease is known as atrial septal defect, and it usually occurs at birth, making it a congenital disease. And what happens is a hole in the heart wall occurs, which you can see here in this picture. It's where it's labeled atrial septal defect. And it separates the upper 2 chambers of the heart, and it makes this hole here, so the blood then flows in through this hole instead of it actually going in its normal pattern. So it's the defect in the heart and the atrial septal. A functional disease is when an organ's function is impaired in some way, but its structural elements are unchanged. So an example of this would be if someone has a mental disorder, or as seen in these films, irritable bowel syndrome, which you can see here. This is where it constricts in the bowel here on this x-ray, and you can see it here more in the actual graphic here where the arrows are. So See how it constricts here, and that's when how the irritable bowel process goes through the bowel here. As you can see, it constricts here through the small bowel, large bowel. It mostly happens in the large bowel though. Okay, now that we know how diseases are classified, let's move on to how they are actually caused. Now, diseases are initiated by some sort of injury, which can be external or internal. So if it is external in nature, it is known as exogenous, which is the first one here, and if it's internal in nature, it's known as endogenous. Now, the external causes are divided into 3 subcategories, and they are known as mechanical or physical, chemical or microbiologic. We're going to go ahead and go over all of those here and get a brief overview. A physical injury can be caused by any type of extreme heat and coldness. If someone has electricity, they're injured by electrocution, atmospheric pressure, radiation, or injury by an object, also known as what is known as a trauma. So if they're any kind of like accident or anything like that. Chemical injuries are then caused by any type of poisonous agent or drug reaction. And the last subcategory is the microbiologic injuries, and they're caused by some sort of bacteria or a fungi, and that's how they're actually classified, and those are considered infectious. So examples of those would be like a nosocomial infection or an iatrogenic infection. Now, the internal or the endogenous causes also have 3 subcategories, and they are vascular, immunologic, or metabolic. We're going to start with the vascular diseases, and they involve some sort of obstruction of blood supply to an organ or a tissue, bleeding or altered blood flow in some way. And then the immunologic diseases are caused by the immune system deviating from its normal functions that affect the body's ability to fight off any type of diseases. The last subcategory, metabolic diseases, encompass a huge variety of biochemical disorders. And these examples could be anything from cystic fibrosis, sickle cell anemia, or Tay-Sachs, which we'll go over those type of pathologies later on throughout the semester to go over in more detail. These are how all the diseases can be caused. Well, this ends our first module, and please feel free to bring any questions on the material to class with you. You will now need to answer a few questions on the material before moving on to the next module that deals with the pathologic process.